This is part 2 of the RN role lecture, and we're going to start out talking about student to nurse. So there are many roles that you can be in nursing, and we'll talk about a few of them here. The care provider assesses patient resources, strengths and weaknesses, coping behaviors, and the environment to optimize the problem-solving and self-care abilities of the patient and their family. They plan therapeutic interventions and take responsibility for coordination of care. And you can find them in hospitals, nursing homes, as a flight nurse, travel nurse, case managers, and doing telephone triage. You can be a leader or manager. They improve health status and potential, ensure safe, high-quality care is provided, increase effectiveness and level of satisfaction. They manage multiple resources and raise attitudes towards the nursing profession. You can go into research. More nursing interventions are based on nursing research than in the past, so it's definitely an area of need. You can be a case manager where they assess all of the needs of the patient and family throughout the sickness of the patient. You can be a nurse educator. A graduate or doctorate level is needed for teaching at a technical college. Or you can be a hospital-based unit educator. So examples are a CTU educator in the hospital or an NTC instructor. You can be a clinical nurse specialist. They specialize in diagnosis and management of medical problems. They're outcome-based and they function as a clinical expert, educator, consultant, and researcher. Or you can become a nurse practitioner. And nurse practitioners assess, diagnose, and manage medical and nursing problems. And many are prescribers of medication once they pass the specialty exam. So what's happening in the market today? There have been fluctuations since the millennium, definitely shortages in specialty areas, and fluctuations in the needs for nurses have varied over the years. The graying of our population and graying of nurses is going to cause a greater demand for educated nurses. With more people getting older, it places more people in need of healthcare services, which in turn places a demand on the healthcare staff. Nurses are also getting older, so that relates to more jobs being available. So entering the profession can be a very scary realization. You are now faced with transitioning from student to employee. Patricia Benner has 5 stages of nursing proficiency. The novice is a beginner with no experience. They're taught general rules to help perform tasks. They are rule-governed behavior, and it's limited and inflexible. For example, they say, tell me what I need to do, and I'll do it. Then you have the advanced beginner. They demonstrate acceptable performance. They've gained prior experience in actual situations to recognize recurring meaningful components. Principles are based on experiences, and they begin to be formulated and guide their actions. Then, typically, after 2 to 3 years, the nurse becomes competent with experience on the job in the same area or in similar day-to-day situations. They're more aware of long-term goals, and they gain perspective from planning their own actions based on conscious, abstract, and analytical thinking, and help to achieve greater efficiency in organizations. And then there's the proficient nurse, who perceives and understands situations as whole parts. Their more holistic understanding improves their decision making, and they learn from experiences on what to expect in certain situations and how to modify their plans accordingly. Finally is the expert nurse. They no longer rely on principles, rules, or guidelines to connect situations and determine their actions. They're much more background oriented with experience. They have intuitive grasp of clinical situations. Their performance is now fluid, flexible, and highly proficient, and people come to the expert for patient or decision guidance. When you're a novice, it's important to gain at least one of these important relationships. By creating one or all of these relationships, it will ease your transition from student to registered nurse within your desired organization. So the first is a mentor. They help recognize weaknesses and strengths, set realistic goals, and help the prodigy attain these goals in the correct way, help build self-confidence and self-professional satisfaction, serve as an advocate, and they're often a long-term relationship. Then there's a preceptor. They're an experienced registered nurse who helps orient the new nurse. The preceptor often assists with socialization and building immediate required clinical experiences. This is often short-term relationship, about 6 to 12 weeks. There's also a role model, observing experienced nurses and adapting your practice to mimic or learn from their practice is always the best to do, but make sure you pick a role model who is a good nurse. And then finally, the residency program. It's a didactic in activities often presented throughout the new nurse's first year of employment. It's aimed to increase knowledge, satisfaction, and retention to the organization. And I was involved in the first residency program that Medford Hospital was involved in, and I was one of 3 that was involved in this 1-year program, and I really truly feel that it helped me become more confident and stay retained. And talking with nurses who have done this since that time, they have also felt that it's very beneficial. So check into that. So in 4th semester, you should start preparing now. You should begin to pull all the pieces together, from care of a single patient to managing a small team. Within your clinical setting, you should be doing all of these things that are listed. Realistic patient care assignments with managing more patients at a time. Seeking out new procedures or patient care situations. Being sure to get involved in new learning skills. Make sure that you read the policy and procedure first, though, because it might be slightly different than what you're taught. And learning interprofessional skills. Effective communication is an essential skill that you have to learn. Participate in rounds, communicating with the physicians and clarifying orders. Hone in on your organization skills. Continue to fine-tune your report sheet. Use priority setting skills and work on delegation and follow-up. And then request constructive feedback. It's better now than later with your new employer. So focus how you can be successful. Negative people can and will suck you in, so stay away from them. Often these people are not good influences on your practice. There will always be things that won't go correctly. First, focus on what went right, and then put constructive thought into how you will do it better the next time. Be flexible and go with the flow unless it compromises your educational knowledge or skill. So being flexible in things like schedule and patient assignments. And once you find your routine, stay with it. It's going to be much easier for you. So using the same report sheet, your routines with patient care like assessments, medications, spending time with your patients and their families, and then treatments. Find time to relax, eat healthy, and maybe even take a multivitamin so that you have some extra energy from that. Attention, planning, and determination are necessary to be successful. How you perceive and handle the transition is going to determine how well you progress through the process. So be realistic about your progress through this transition. Your expectations may not meet the reality of the situation. You think you will know everything, but you're going to have a culture shock. Expect that you will have good moments and then not so good moments. Celebrate your successes and learn from those experiences that do not go as well as you thought they should have. Excuse me. Communicate your needs with those around you and use your perceptor. Don't be shy or things can get missed and overlooked. If you don't understand, make sure that you ask. So let's talk about reality shock. During reality shock, the new nurse will become aware of the inconsistencies from what's taught in school to how individual nurses choose to practice at the bedside. You will choose what kind of nurse you will become. Remember that just because another nurse is doing it doesn't make it right. Continue to follow hospital policies and procedures and stay current with your practices and education. Reality shock often leads to a great deal of stress. One needs to have good coping skills to get through that. Find an individual to share your struggles, frustrations, and joys with. There are 4 phases of reality shock, and we're going to talk about them individually. So during phase 1, it's important to find a colleague or a few colleagues to share your experiences with. One's often paired with a preceptor as a new nurse that's still in orientation, so that's a good person to use. Enjoy this phase, continue to learn and grow through it. Seek out different educational movements while you're still in orientation. This is just going to make you stronger and more confident nurse for the upcoming phases. In phase 2, orientation is now over, and you have to take a team of patients and function as one of the team. 8 to 12 weeks into the new job is typically when this happens, depending on whatever unit you're in. So new nurses often face new skills or experiences that make them feel incompetent or uncomfortable. These experiences make the new nurse critical of their own skills or abilities. The new nurse often second guesses his or her thoughts or decisions. Some typical feelings during this time are failure, being frightened, being defensive, rejection, and lack of accomplishment because they have too frequently had to ask for advice. So gray areas of nursing are often seen, or what the new nurse was taught in school is not what's done in practice. Be the nurse you were taught to be. Don't take shortcuts because it can hamper your patient care. Be sure to fully understand your organization's policies and procedures because these will outline the care standards that you need to be giving. Don't we all just wish we could remove ourselves from this situation? In most cases, that's not an option. But be careful with how you present yourself when you're stressed. How you act out may be misunderstood by others. As a nurse, you will have to learn how to effectively and professionally manage stress. Often these reactions stem from unrelieved stress and lack of communication. So shock reactions. The natives are the new nurse who adopts the ways of least resistance and often takes shortcuts. It's very easy to fall into this dangerous way of nursing, as you can be overwhelmed with what you need to do and the knowledge it takes to get you to where you need to be to perform safe, competent care. An example is becoming complacent with your knowledge, not fully understanding the care being provided, the actions and side effects of medications, or the procedures that you're performing. The next are the runaways. These people leave the nursing field or enter a different type of nursing. Remember, the grass is not always greener on the other side. It's just a different shade of green. Then you have the rudders. They do only what they have to and nothing more. They do not get involved. Nursing is just a job for them, and they're not interested in the welfare of the organization or the patients they're caring for. They do not get involved in committees or projects that would advance their care or the knowledge that they attain. This is not in the patient's best interest, and it's not in your best interest. There's also the loners. These are the nurses that keep to themselves. They work shifts where there's less people around, like the night shift. So nurses are more prone to these due to the need to be perfect and the inability or difficulty to say no. With burnout, new nurses often become burned out because of multiple responsibilities that they undertake, and it's important to be involved, but only when you're ready. Compassion fatigue is repeat exposure to patients' experiences that makes them at a higher risk for compassion fatigue. For example, constantly seeing the same type of patient, like a CHF patient that keeps on coming and coming back and coming back. Burnout and compassion fatigue can occur at any point in your nursing career. Be alert to it. If you notice it, figure out what you need to do to counteract your feelings. You might need to make a change or go on vacation. In phase 3, enjoyment with being a nurse starts to return. The new nurse starts to feel a sense of belonging. The new nurse is able to laugh at his or her own silly mistakes or questions that they asked, but learning is still occurring. In phase 4, the new nurse now begins to enjoy coming to work and not dreading it. Work expectations are easily met. You feel more competent in the ability to safely make and complete nursing assignments, skills, and tasks. You start to get involved in other aspects of the organization. You feel as though you can make a difference, and you start becoming a change agent. A sense of pride with the work that's completed is what's happening. So these are excellent points that will help you through this difficult time. One of the 3 most important points that I see here are think before you answer, So there's going to be times when you feel pressure to give an answer to like a physician, a nurse, a patient, or their family. Before you open your mouth, think about what you're going to say. First, the second is support your coworkers. If you scratch someone else's back, I promise they're going to repay the favor. Take the time to help others, to listen and give support. If you do these things when you're having problems, they will help you out. I can't tell you how many times the CNAs have saved my butt. And then say no. It's okay to say no. Before saying yes, think about, can you safely perform the task or project within your current load? And if not, then you have to say no. Attitude is key. When the world seems against you, remember, you were trained to do this and you can do it. Nurses have a tendency to eat their young, so just try and stay positive. If you have a good attitude, you're going to make it through, and your coworkers will gain trust in your abilities to handle difficult situations. Coworkers gain your trust with good behavior and teamwork. These are all tips at staying positive. Surround yourself with positive people. So where do you see yourself in 5 to 10 years? What are your academic goals? Do you plan on certification, on getting your BSN, your MSN, your DNP, or even your PhD? I just want to tell you that I've never regretted continuing on with my education, and I really suggest to everybody that if you have the opportunity, continue with your education. So let's talk just a brief time on evaluations, just so you know what to expect with them. There are 5 different evaluation types that we typically talk about. Self-evaluation is measuring your own performance. Preceptor assessment is when you meet with your preceptor at regular interviews and you review your progress. And then there's formal evaluation, peer evaluation, and 360-degree evaluation that we'll talk about in the next 2 slides. So successful job performance requires a clear understanding of what work is to be performed, desired outcomes, and how well the work is completed. And that's why we do evaluations. The performance appraisal process ensures that employee and supervisor expectations are aligned. Through this process, the employee and supervisor can find opportunities to work together to improve job performance and grow professionally within the organization. Many organizations are now going to registered nurse portfolios. So with the formal evaluation, the objectives are to assess and measure individual performance on the job, to identify opportunities for improvement and advancement, and to develop professional skills through open and constructive feedback. There's also peer evaluations where you evaluate your strengths and opportunities for growth. Your peer does, and the person being evaluated is viewed from a holistic approach, and teamwork is essential with that. And then finally, the 360-degree feedback is a system or process in which employees receive confidential, anonymous feedback from the people who work around them. This typically includes the employee's manager, peers, and direct reports. The person receiving feedback also fills out a self-rating survey that includes the same survey questions that others receive in their forms. The 360 evaluation measures behaviors and competencies, provides feedback on how others perceive them as an employee, addresses skills like listening, planning, and goal setting, and focuses on subjective areas such as teamwork, characters, and leadership effectiveness. And that's the end of our RN Role lecture.